All right, today we're going on a mission to understand one of the most common and most important respiratory medications out there, albuterol. Have you ever really stopped to think about what's going on in there? You take a puff from an inhaler and suddenly you can breathe again. But what's the magic? What's the science behind that amazing feeling of relief? Well, that's exactly what we're about to dive into. So, first things first. To really get why the rescue is so effective, you have to understand the emergency. It all starts with a distress call, a real SOS coming from deep inside your lungs when your airways get into trouble. And the main villain in the story, it's something called a bronchospasm. Just picture this. The tiny little air passages in your lungs are literally being squeezed tight, almost like a boa constrictor, by the muscles around them. When that happens, air just can't get through like it's supposed to. And that's what triggers all the wheezing, the coughing, and that awful shortness of breath. So when does this distress call actually go out? Well, it's not just for asthma, that's for sure. Albuterol is called into action for a whole range of things, from airway diseases like asthma and COPD, to a bronchospasm that's caused by breathing in something toxic, or even during a severe allergic reaction. It's also the go-to for exercise-induced attacks. But get this, it's also used to treat dangerously high potassium levels. Yeah, you heard that right. It actually helps push potassium from the bloodstream back into the body's cells. A totally different but pretty incredible life-saving job. Okay, so the emergency is clear. The distress call has been made. Now it's time to meet our first responder, the hero of the story, albuterol. So at its heart, albuterol is what's known as a sympathomimetic drug. Now, that's a mouthful, I know, but all that really means is that it mimics the signals from your sympathetic nervous system, the fight or flight response. It's one primary mission: to get those smooth muscles in your airways to just let go, to relax, and to do it fast. Let's break down its resume, or what I like to call its superpowers. We already know its class is sympathomimetic. Its action is to be a bronchodilator, which literally means it dilates or opens up the bronchioles. But its real specialty, the thing that makes it so good at its job, is that it's a selective beta-2 agonist. So what on earth is a beta-2 agonist? Okay, think of it like this. Your airway muscles are just covered in these tiny little receptors, kind of like docking stations for a ship. Albuterol is designed with a unique key that only fits into one specific type of docking station, the beta-2 station. And when that key slides into the lock, it sends one powerful, simple signal to the muscle. Relax. And that's the really cool part. It's selective. It's aiming only for those beta-2 receptors in the lungs, trying its best to ignore other receptors, like the beta ones in your heart. That's how it helps keep side effects to a minimum. So having the right key is great, but it's useless if you can't get it to the right lock, right? So how exactly is our rescuers deployed to the scene of the emergency? Well, there are two main ways. The one you probably see most often is the metered-dose inhaler, or MDI. It's that little canister that gives a quick, pre-measured puff. It's super fast, super portable. The other method is a nebulizer. That's a machine that takes a liquid solution of the medicine and turns it into a fine mist that you breathe in over, say, 5 to 15 minutes. It's not as portable, but it's great for delivering a bigger, more sustained dose, which is often what you need in a more serious situation. And listen, this next point is something we absolutely have to hammer home. A spacer, that's the little plastic tube that attaches to the inhaler, is not just an optional accessory. It's critical. It helps make sure the medicine actually gets down deep into your lungs where it needs to be, instead of just splatting against the back of your throat. Without a spacer, a huge amount of that life-saving medication is just wasted. Technique really, really matters here. Now, just like any powerful tool, albuterol has some really important safety rules, protocols that both patients and doctors need to be very aware of. Remember how we said albuterol mimics your fight or flight system? Well, it makes sense that some of the side effects can feel a lot like an adrenaline rush. You might feel your heart racing, that's tachycardia. Or maybe you notice some shakiness or tremors. These things are usually tied to the dose you're taking, but it's really good to know what you might feel so it doesn't freak you out if it happens. It's also super important to be cautious if you have certain other health conditions, because albuterol can affect your heart. Anyone with a cardiovascular issue needs to be careful. The same goes for people with diabetes, an overactive thyroid, or a history of seizures, since it could potentially make those things worse. And you've got to watch out for how it plays with other drugs. For instance, beta blockers, which are often used for blood pressure, can literally block albuterol from doing its job. Some older types of antidepressants can actually amplify albuterol's effects on the heart. And, as you might guess, using it with other stimulants can definitely ramp up the risk of those heart-related side effects we talked about. Now, for a really important question that a lot of people have, what about pregnancy? Well, here's the good news. For expecting moms who need to manage their asthma, albuterol is considered the go-to, preferred short-acting medication. The top priority is making sure both mom and baby are getting plenty of oxygen, and albuterol is a trusted and safe way to make sure that happens. Okay, we've seen the emergency, we've met our rescuers, and we've gone over the safety rules. So let's do a quick mission debrief and review the most important takeaways. So, how fast does this rescue actually happen? It's incredible. Albuterol gets to work within just 5 to 8 minutes after you inhale it. That super fast onset is what makes it such a phenomenal rescue drug. And that feeling of relief? It typically lasts for anywhere from 2 to 6 hours. And that brings us to the single most important thing to remember about albuterol. Say it with me. It is a rescue medication. It's not for everyday long-term control. Its whole job, its entire purpose is to pull you out of immediate danger, to stop that bronchospasm dead in its tracks. Look, albuterol is an absolutely amazing firefighter for putting out the blaze of an asthma attack. But it does leave us with a bigger question, doesn't it? What's the plan for stopping those fires from ever starting? And that's where things like long-term controller medications and lifestyle changes come into play. But that's a whole other mission for another day. Thanks for joining me on this one.